A warm welcome, everyone, dialing from across the world. We are now very excited to be kicking off this session where we will be learning about how corporates and social entrepreneurs are joining forces in response to the COVID-19 pandemic. How do they collaborate? What are the challenges they encounter? And what do they see as learnings and opportunities for the future? So we are very privileged today to be hearing from our great panelists. A brief introduction, we have Dr. Mocha Lantam, Director 2020 Microclinic Initiative. He's a physician, scientist, and entrepreneur who's transforming healthcare in Africa's resource-limited settings using mobile and e-health technologies and inclusive business models to improve access to care and medicines. We are also very excited to have with us Margot Koymans. She's director at Philips Foundation, who has had an impressive career as a lawyer and an entrepreneur in food, real estate, CSR, and sustainability, and now is really driving the intersection of private sector and society, taking a result-driven approach to achieving societal impact paired with financial results. And last but not least, Kate Heine. She's the Director of Sustainability at Zalando SE, bringing Zalando's corporate sustainability strategy to life and driving actionable results in becoming a sustainable fashion platform with a net positive impact. She's also held leading positions in sustainability at Target Corp, CNA, and the Sustainable Apparel Coalition. So please join me in welcoming our panelists. We are really excited to have about 40 minutes to really have an in-depth discussion on their collaboration experiences. You also have the opportunity to please ask us questions. We want to have a very candid discussion. We're all excited to learn from each other and think about how we can scale impact together. So with that, I'll hand it over to Lotte for the check-ins.
Thank you very much, Pei Yoon, and also a very warm welcome from me to all of you. Great to be here today with you, with our speakers, and have you all watching. My name is Lotte, and I'm basically just here today to make sure that the session runs smooth. And so if you have any technical hiccups, any questions, please put them in the chat on Swapcard, and I will try to answer them. Also, if you have any questions for our speakers today, great if you could put those in the chat, and we will try to integrate some of these into our conversation today. Now, before we start this conversation with our speakers, it would be great to hear a little bit from you, just to kind of get an idea of who's watching out there. So you're already putting some of it in the chat, I see, but we would love to hear from you where you're calling in from. So if you could keep putting that in the chat, that would be great, just so that we have an idea of where you're watching from. And also, it would be good if you could let us know on a scale from 1 to 10, 1 being very little and 10 being very much, how experienced you are with today's topic of collaboration between social entrepreneurs and larger corporates, just to get an idea of who's watching and how experienced you are with this topic. Now I'm going to let you put that in the chat before I give the word back to Pei Yoon. Just seeing everyone calling in from Madrid, from Paris, Holland, Budapest, India, loads of different locations, Berlin. Welcome everyone. Holland, Germany, lots of Europe. It's also early for many, or late for many, later for other parts of the world. Bucharest, 6 out of 10, 6 out of 10. Yorkshire, England, a 7, very nice, 5, 6. Okay, so we do have a little bit of experience with this topic. That's good for our speakers to know. A 5. Okay, so it's going to be an informative session for some of you, I hope. I hope it will be a chance to learn from our speakers. 4. Thank you very much. Keep putting it in the chat so that we will know. And yeah, without any further ado, I would love to just pass the word back to you, Pei-Yun so that we can really start this session.
Great. I should also introduce myself very quickly. I'm calling in from Amsterdam. Great to be with everyone. I'm Global Director of Social Impact at Kearney. We're a global management consulting firm, and we've had the privilege of working with Ashoka for many years now, supporting its fellows, as well as supporting collaborations between businesses and social innovators. So with no further ado, let's kick it off. I have asked each of the panelists to share one photo that symbolizes a moment in their collaboration experience, so they can share what makes them so passionate about this subject. Let's start off with Margot.
Yeah, thank you, Pei-Yun. Yeah, it had to be let's say a composed photo, because this has been a crazy year, of course, and in the COVID-19 response, we have been all over the world, and we have collaborated with many parties and social entrepreneurs as well. And it was a crazy experience where we had to act very agilely. And yeah, I like that kind of dynamics. Yeah, among the parties, of course, which we collaborated was Mocha and Mocha's Mocha Lantum, his company, responding very quickly to the pandemic and how to reach the people that needed care. So yeah, and many more, as you can see at the pictures, but it would take too long to elaborate on it, I think.
Great, we'll come back to you, I'm sure. Mocha, next up.
Hi everyone, this is Mocha. I hope you're hearing me okay. I turned off my video because of the bandwidth constraints here in South Sudan. So hopefully my voice is heard. Pleasure to be here on the call, and really pleasure to be here with our partner and collaborators, the Philips Foundation. Hi Maho, and also the rest of the Ashoka team. The picture here shows me meeting with the home care team. In blue, you have the nurses, and then in the yellow jacket, you have the riders. And together, they go to homes to identify persons in need of medical conditions, refer them centrally to a telemedicine team, and then we're able to prescribe and dispatch medicines. And this is an initiative that was inspired by a collaboration and our planning process, if you will, for the partnership with Philips. So again, delighted to be on the call.
Great, thank you very much. And Kate?
Hi, I'm very happy to be here as well, thank you. This picture is perhaps not as not as emotive or as the last two, but really represents the partnership that Zalando and Ashoka have for the Changemakers United, and really this is, for us, a really important partnership to be able to work together to further amplify and bring to life the innovations that exist and the partnerships between innovators across Europe, Asia, Africa, etc. So really excited to be here and be able to talk about it.
Thank you. And that's a super inspiring quote, right? The crisis really inspires us. So we make the most out of this opportunity. So now I'm gonna kick off the discussion with a few questions. And in the meantime, please also, other members of the audience, please share your questions in the chat, and Lotta will be reading them out in a while. So let me kick it off then. So I have a question. I know that these partnerships, these collaborations were already, the relationships had already been formed with Ashoka for quite a while already. My question was, how were you initially thinking about collaborating? And when the COVID-19 pandemic hit hard, what was the impact on the collaboration? How did that change, your priorities, the scope or the focus of what you were doing, the resources that were available to you, the timelines, the ways of working. Because I think collaboration itself, it's a pretty massive undertaking, even on a good day. And with the COVID-19 pandemic, how were we forced to quickly evolve and adapt? Maybe I can start that question off with Margot, and then we'll get Mocha's side, and then we'll hear Kate's side.
Thanks. That's a good question. How did we think about collaboration? We were completely aware that we, as Philips Foundation, working in let's say mature markets, the company is not able to really understand the ecosystems in underserved communities. So that's the reason to collaborate with social entrepreneurs that really do understand and have deeply dived into the local ecosystems and understand those in a way that they have found ways to address these people. It makes no sense to try and invent the wheel from a distance and not being part of that ecosystem. So that's why we not only believe in collaboration, but think it's essential to solve the biggest problems in this world. So that was a no-brainer for us, and hence the collaboration with Ashoka, because Ashoka selects the best social entrepreneurs in the world, as we have noticed. So and then especially in our case around healthcare. Philips is a healthcare technology company, and we as Philips Foundation are a not-for-profit entity trying to establish quality healthcare for people that have no access to healthcare, and especially in low resource settings, let's say. So the collaboration with Mocha was obvious, I would say, and when COVID-19 hit the world, he was completely agile in finding out how to change the business model and how to adapt to the new situation. The motor rider squad he established, reaching out to the households which couldn't come to the clinics anymore, was a great idea. And in no time he had these people on their bikes serving the company, but also the community. So maybe he can tell a bit more about how he did this and answer your question as well. Did we lose Mocha?
No, I heard you, Maho. Thank you very much. Yeah, excellent. So really, I just wanted to say right out of the gate that, collaboration is something that, empirically we all aspire to, but inadvertently quite difficult to execute. As Maho mentioned, our collaboration started in a very advanced stage because of the Ashoka context, whereby we were introduced as, if you will, tried and proven entrepreneurs in healthcare. But that in and of itself is not sufficient to establish a collaboration. And so really what we are able to experience is that it's quite a process where you go through, a trust building phase. The trust building phase is really one of discovery, alignment around strategic priorities of both entities. I would imagine in this case, the Philips Foundation has a strategic plan. We have our business plan, and looking for that common zone, that zone of common interests, and that zone of opportunity is something that required a lot of conversations, where we initially, the Philips team was going to come look at the work we're doing, and then we traveled to Amsterdam, and that's really how it went. And then obviously, at the end of the day, you need now to have the governance processes aligned in order for the collaboration to go into operations. So that process really, I would say, it's quite emotionally and resource intense. Now, secondly, I think from our perspective as a company, when we think about collaboration and before we engage, we try to kind of answer three basic questions. Will the collaboration speed our access to market? Or will the collaboration increase our access to financing? Or will the collaboration increase access to supplier? Right? And ideally, you want all of those three things to be ticked. In the case of our collaboration with Philips, it really has the potential for us to increase access to market. But we as a company, we could stand to get access to market, access to suppliers, and access to finance. And so it warranted us to make the necessary investments in terms of time. And it took us a good 12 months from initial conversations to closing the first agreement to get things going. And the last piece is that, as we've had a lot of conversations on WhatsApp, on Zoom calls, on Teams, you name it, ultimately, the collaboration has centered around what values do we stand for? And I think that is ultimately what makes a collaboration work at this scale. And the value we have pegged the whole conversations around is how do we make healthcare affordable and sustainable, but not free. And that is usually the conflicts that you could have between partners, where a partner may perceive the market as you need free care, and that makes it very difficult to have a viable business model. So we kind of had to look for that zone around what values are commercially viable. And I think we're fortunate that because our business model sort of aligns with the value systems of the foundation, we were quite able to design a solution which we think would be very competitive in the market and could be a win-win for both parties. So in a nutshell, it's an exercise which, if done properly, would really enable certain capacities to be built along the way, gives a lot of clarity on what customer journey we want to address, and really support our business model end to end.
Great. I love that. And I want to make sure we come back to that. But let's also hear the perspective from Zalando, because I think they were supporting with the Changemakers United platforms, also the COVID-19 response, not just from the health angle, but also a more holistic view, given it was such a complex crisis. Kate?
Thanks, Payun. Yes, complex, I think, does not explain it, and it's still going on. But so when the pandemic started within Europe in March of this year, I think Zalando, we acted quickly. We worked hard to react very quickly with measures that protect our own employees and keep our business operational and supporting our partners. But we also sought out how we could be part of the solution for the communities that we operate in at large. And the effects of this pandemic are not, I think we don't have the same alignment that Margot and Mocha just spoke about in terms of business model with the effects on the community right now. So we really looked and tried to leverage our startup spirit and our entrepreneurial history in order to scale impacts. So we've worked with Ashoka as a longtime partner over the last number of years. I think Margot did a great job of describing, the role that we all play and the importance of working with entrepreneurs and innovators. And Ashoka has a phenomenal, vast network of these social entrepreneurs that offer innovative solutions. So for Zalando, we wanted to support in further developing and scaling the solutions that were being worked on towards the short and long-term impacts of the pandemic. As I mentioned, you know, our value system and the way that Zalando operates, we grew out of the same entrepreneurial spirit with the purpose to offer unique solutions in fashion and e-commerce within Europe. So we really wanted to use that strength and support others in scaling their solutions to address the challenges that we have. And we ended up selecting 20 of the promising solutions and connected them with experts. I know we'll probably talk about the program a little bit more at the virtual summit in May, much like the one that we have today. And those entrepreneurs were supported with funding and expertise, both from Zalando as a founding partner to the Changemakers United, but also from several other companies that joined forces, whether it was in direct donation or in-kind support. But the program has created an ecosystem of innovators, and with 121 pro bono experts and Ashoka staff support, we've been fostering or seeking to foster collaboration for Zalando at the European-wide scaling. But I also am really excited about the knock-on effects of that, and I know we'll get to it. But I think, like I said, Margot really hit a lot of the key points around Ashoka having a fantastic network, the role that we play as Zalando, not in creating the solutions, but working with and supporting those who are creating the solutions, who are closer to the direct impact. So we were really seeking how we could participate in that, because that is only together can we actually address these issues. So that's the short version.
No, that is really great to hear. And I would love to probe a little bit more, if I may, around the inner workings of, you know, how that unfolded, at least on the business side to start with. You know, indeed, in the spring when the pandemic really hit hard across the world, as you mentioned, like for many businesses, the first step was to make sure that, you know, their employees are safe, in some ways to maintain business continuity. And, you know, for some businesses, they also saw in some ways a realignment of priorities, right? So for example, non-essential spend was being slashed. You know, the management focus was really just on like protecting the core business first and foremost. And I was curious, you know, both of you represent companies that have had a long history of committing to social impact. But, you know, I'm sure that there must have been some upheaval with the COVID-19 pandemic. Was there, you know, some, I guess, in engaging your colleagues in other parts of the business, were there some challenges in terms of, you know, just getting people's time, commitment, attention, you know, given all of the upheaval that was going on, and how did you kind of navigate those changes quickly in order to mobilize? What was that like? Margot or Kate?
If I talk about the environment I was in, the Philips company, we work closely. Of course, we are very closely aligned with the company, and there was a deep collaboration from day one, from the first minute. Not only because we as foundation are seen as a pot of money or an ATM, let's say, but especially because the company has chosen very wisely, I would say, to be a healthcare technology leader, to be a relevant company societally seen. So being relevant in the world, in what you do, what in your core business is the best ticket to the future. And that is expressed within the company largely, not only, of course, becoming and staying a financially viable company, but also in terms of contribution in environmental and societal issues. So when we had to change course, or we had to adapt to the new situation, there was no delay whatsoever, because the company is used to adapting to the environment in terms of what are the biggest needs, and how can we as a company be of real support to this issue, to people that are confronted with this issue. So it was a logical collaboration, and it deepened throughout the pandemic between foundation and the company. And so many people, we are completely dependent on volunteers in my small team, volunteers from the company, and we had no trouble finding people that wanted to support in the work we did. So and we also became kind of a thought leader around the pandemic within the company. So a knowledge hub where a lot of information about what worked and what didn't work, and how to fast and agilely react was combined. So I think it strengthened the company being in the field of healthcare already. Yeah, that was a lucky choice in this case. So no, it became more clear that having a purpose, a real substantial support to society, is essential to be resilient enough to survive, even, I think.
Yeah. I think, again, Margot has said a lot of it. I think we have a lot of alignment. Collective action is a core element of our sustainability and corporate citizenship work for Zalando. So did we have challenges internally getting people to participate or take action? No, not at all. I mean, I think as you restated, we certainly have really looked at how we can ensure the safety of our own employees and ensure the operational longevity of our organization. But equally, we said, we are and want to and need to continue to be a responsible citizen. And how can we participate, and how can we most appropriately affect the outcomes of this horrible situation that we're in? So we already knew from the Hello Festival that we had developed with Ashoka that accelerator programs have the potential to take on a life of their own. And we saw that through the Hello Festival. And so we really sought to leverage that model and kind of use that in order to grow and bring as much of the collaborative action forward. I think, in terms of challenges and learnings, I think we probably have more on how to activate the program and how we interacted, either ourselves with innovators or others with innovators, more so than whether or not we could get it up and running in the organization, because that was much more of a given in terms of commitment and making it happen. There was a lot of excitement about that. But in terms of perhaps some of the learnings, I'll say learnings, how about that, instead of challenges? So while we're able to move very fast in the creation and the setup of the program and connecting 121 pro bono experts with the innovators, we probably won't see a lot of the long-term effects overnight. I mean, we certainly won't already. We have some insights, but we know that we'll see more of this coming along as we work longer, because collaboration takes time. And I think that was one of the, I think I can imagine, and I know everyone's hinted at it so far, but this point that it takes time and effort. Collaboration needs time. One of the entrepreneurs in this program actually said it's not something that comes up from nowhere. It being collaboration needs a mutual understanding between organizations which have already met before and look at each other's work over time to create confidence And during times of uncertainty, such as a global pandemic, it's even harder than anything to catch the possibility of collaboration. So not only does it take a lot of time on a good day, but it takes a lot more time during such a difficult, complicated, stressful time.
Absolutely. And I also wanted to come back to what Mocha was sharing earlier. He talked about how collaboration requires a pretty intensive trust building phase. I think he also said that, you know, it's pretty emotionally and resource intensive. He talked about the fact that it took a good 12 months from the initial conversations to closing the first agreement. The visits to Amsterdam really helped. And you know, what would be your advice, given that, you know, going forward for other social innovators and businesses who are exploring collaboration, who may not have had the benefit of, you know, taking their time to, you know, build that trust and are feeling like, okay, do I have to rush it? How do I build that through just Zoom calls? What would be your advice about, you know, how to get off to a good start? Mocha, you're welcome to answer as well. And by the way, this is the last question for me, and then we'll open it up to the questions from the chat shortly. So any thoughts? How do we do this in a remote kind of environment?
Sure. Actually, my view about it is that COVID or no COVID, it really boils down to what is your impact strategy, right? And if the impact strategy is sort of hands-off, whereby send me this paperwork, send me this report, send me this information, and then we decide, that is one form of engagement. And then the other form of engagement is to say, can we learn together and understand the issue and come up with a common framework on how we want to address an issue, right? That's a different kind of impact engagement process. And obviously there are variations between those two ends of the spectrum. Now, I prefer as a venture to have partners who have a shared understanding of the customer, because it takes away a lot of the guesswork. It allows for really co-creation and a very deep shared understanding. Once as you start migrating away from the customer, then the process tends to be more about fiduciary alignment. And fiduciary alignment is the most dangerous type of collaboration, because it's no longer about the customer or the beneficiary of the service. It becomes about what is convenient between the parties who are engaged in the collaboration. And that is usually where by certain promises could be made, certain expectations are set, and then once as you actually go into the implementation phase, then it becomes very difficult for both parties to hold their end of the bargain. And so I tend to see that, you know, really it's about time whereby from a partnership perspective, especially when in one hand you have a funder and an implementing partner, that the shift be more around the customer experience. Define who is your customer, who is, you know, what impact do you want to create, right? In the case for the conversations we had with Maho over the years, it was a very intense conversation between how deep can you go into the BOP and remain financially viable. So a lot of the conversations remained around that. And when Maho visited in February, that was really the substance of the conversation. And we came to the common understanding that focusing on blue collar workers and designing a solution for the low to from the low income to middle income market segment was the right fit for what we're trying to do. And we both agreed that if we go too far into the deep areas, then now we start getting squarely into the public sector domain, and that becomes a zone of friction. So I would say it's all about impact strategy, in my opinion.
Right. So really core alignment on that, COVID or no COVID. That is something
Yes,
that we have
and
to get
if I may add, I'm sure that if we weren't able to really visit the company and see the business process and spend time together and really, let's say, scrutinize and ask all the questions that had to be answered, and deeper understand, getting the deep understanding on the how and the why this company was set up, and how the processes are, and what kind of quality also is delivered. I think if we weren't able to really visit, that we would not have been this far in the collaboration. Because yeah, paper is patient. You can write down anything, as Mocha says, to the satisfaction of your potential funder or partner. But it's all about understanding the business model. And if you don't believe that model in the long run, then you don't feel confident to step in.
Yeah, and I'm curious, like for some of the social innovators or potential partners listening to this call, and they're like, okay, Philips is doing great work. I would love to start a collaboration. Unfortunately, maybe for the next few months, it doesn't look like, that kind of face-to-face on-site visits is going to be possible. How else, can we potentially build trust and shared understanding?
Yeah, it's then the discussions remain, of course, exchanging views and really understanding each other's objectives. And if those are aligned, then you're getting closer to collaboration. It's not only money. It's much more about entrepreneurship and agility. How to respond. I don't believe in 5-year plans, and maybe I'm saying something completely against all odds. But this world changes so rapidly. Your close surroundings change so rapidly. You have to be agile as an entrepreneur to address those changes. And if you cannot, and you stick to a 5-year plan because you wrote it down, then you will seize in the end. I don't believe in that kind of business planning anymore.
Yeah. I mean, I'm not sure that I can add much to what's been said here. I think to your follow-on question there, Payun, and Margot's comment, I think I could reiterate this call out for time. So if we cannot have conversations in person, I think unfortunately more of these virtual ones, but then we all know at this point that if the effect that we have in person needs to be like 2 or 3, or I don't even know the number, times as much time virtually than it might take in person. But what this effort and our partnership with Ashoka and the work that we are seeing, I think, has really reminded ourselves and our partners that like everything matters and every bit counts. And the collaboration between all of the actors and societal players, no matter how big or how small, is what is going to help us to actually address the challenges that we're facing right now. So it's not one, it's not the other, it's both, it's all of us, it's together, it's in multiple different configurations, but every part of this counts.
Great, thank you. On that note, Lotte, anything coming through the chat?
Yes, we do have some questions. We already talked a little bit about the challenges and about the importance to really get to know each other and to build trust. I have a few questions here for Kate also about, first of all, maybe you could give an example of how you've supported, and also how do you sell, between quotations, the impact that you're making with this group of social entrepreneurs internally in your company?
Sure, happy to. I'll start with the second piece, which is what I said before. We don't have to sell it. We've been working with Ashoka for a number of years. We developed the accelerator model through the Hello Festival. And so when we looked at and we asked ourselves, how can we participate and what is the action that we need to be taking right now, it just made a lot of sense to call up the Ashoka team and say, hey, listen, how can we participate again and contribute to the work that's going on. So we were the founding partner for this in terms of the how does it work. So we have worked with kind of creating the program, doing the kind of the planning with the organization, holding the summits, doing the kickoff, etc. A few of the examples that came out of the first round within the European market is one is mask makers. So in Spain, innovators coordinating more than 20,000 makers in building face shields, masks, respirators, and incubator boxes for hospitals. And they did that through 3D printing. So really, they were an innovator in the program and were able to scale that based on the support from the program. Another one is My Mind in Ireland. And this is a fairly, kind of a unique community-based mental health service that offers online counseling sessions in order to create equal access to mental health support early, affordably, directly, and without stigma or delay. So those are just two out of the 20 plus innovators that were a part of the program that we supported, and being able to see the innovations scale and replicate across Europe, and then the program replicate in other continents, really helped us to be excited about the reach and the change that we can affect through that. So we were just a partner and a support for making that happen, and really pleased with the knock-on effects and everything that continues to be growing.
Thank you, Kate. And maybe one more question, and for Margot then, or for Mocha, maybe more considering the challenges as well, but then did you see any challenges when it comes to collaborating across cultures, not only sectors, but also cultures?
No, I don't think so. A common purpose is felt commonly, and providing access to care to most disadvantaged communities and households or people or is something that appeals to, in fact, everyone. And so I agree with Kate, or we have the same experience. It's really easy to find people in the company, even outside of their working time, want to support, want to collaborate, want to do something. They feel they are they stand outside of the let's say the COVID pandemic effects, and as if they can do nothing. So they want to, maybe even more so in this situation, they want to do something, they want to contribute. And it was really easy to find people in any culture. Well, the company works worldwide, from India to South Africa, from China to Latin America. So it's not difficult to find people to support. I come across the most difficult pronounceable names within the company, and really a culture is, I didn't see it to be any obstacle.
Thank you, Margot. Mocha, do you have anything to add to that before I give it back to Pei-Yun? I think we covered most of the questions in the chat, Pei-Yun.
So I agree with Maho, and I disagree with Maho on one point, and she would understand where I'm coming from. Everything she said was on point, but I think that the biggest advantage we had from a culture perspective was that Maho background is in business. And so, compared to other partners that we have engaged who are looking at coming into a collaboration from the traditional philanthropy business perspective, it's a very difficult conversation. Let me give you just a practical example. Some of our partners come and say, we want to affect children under 5 in rural areas. And so that is what we want you to do. And with a very clear lens, it must be rural, it must be 0 to 5 years, it must be, this is like, okay, how do you do that? And then you say their customer acquisition cost of getting to that village is $25 per person. And they look at it and they're like, okay, what does that mean? And we just did not have those conversations with Maho at all. It was purely, here's the business model, here's the cost, here's what it looks like as feasible. So at all times, we were in the culture of business and looking at venture, entrepreneurship, and impact in one sentence. Whereas if some partners are purely coming from M&E, for example, we received a proposal last week, and they say you cannot invest in working capital, you cannot invest in inventory, you cannot invest in new personnel, but we are willing to give you $100,000 to $1 million for M&E. And I'm like, how can I take debt for M&E? I cannot take debt for M&E. And so you see a lot of projects and partners coming in where the emphasis on how can we get data as opposed to how can we solve the problem. How can you fit with our development agenda as opposed to how can we create an enterprise that creates a solution for the market? And that is really where I feel like we were really fortunate to have the person of Maho in her seat going through these conversations. And this is something that I've said in other forums in her absence, and I think it's important that I also say it in her presence, right? But it is time that we kind of align with the customer needs and the business potential as opposed to a preset agenda by a corporate governance body, which becomes almost impossible to implement on the ground. And that is why you have so many failed ventures, because the customer was never the beneficiary, the customer was the board chairman.
That's really, thank you for sharing that experience. And I have a follow-up question, I guess for all three of you. How, in your collaboration experiences, how do you define with your partner a joint metric or measure for success? You know, other than it feeling like a great collaboration because there's trust, there's been some, outcomes and implementation, but how do you know, like, okay, this was, pushing it as far as I had expected, or how do I then communicate the impact of what we do? So do you have some joint measures of success? And what's your experience in what kind of measures or metrics work well?
Kate, you first. This time.
Certainly. I mean, yes, I would say that setting joint goals per project, per partnership, really spending the time to, exactly what's been said already, is spending the time to agree and align on the outcome that you're looking for on both sides and together. And then identifying how you're going to measure that. All of that is incredibly important and is obviously the basis for, I mean, I'm just sort of repeating, I think what Mocha has said very eloquently, but I mean, is the basis for a strong partnership. I mean, aligned goals, aligned outcomes. I mean, I also understand that organizations, both companies and entrepreneurs, can come together for different reasons, that they might, one might want to achieve something and the other might want to achieve something else, then they might not be a good match. right? I think that that's what the discussions need to uncover, is whether or not it is a strong collaboration and that you can jointly support each other in what you're trying to achieve. I mean, I think there's learning to be had on both sides, and that's perhaps not something that is always taken into account, or especially in speed times of needing to move quickly, I think is perhaps something that can unfortunately be not focused as much. But with I mean, this is what we Zalando had our initial multiple conversations with Ashoka on the program on Changemakers United, is what are we trying to achieve? How are we going to do that? And what is the best, what is the best way to do that? How will we know when we succeed? And how will we be able to share that information? So those are all very common questions and discussions that need to be had. So time needs to be spent on the collaboration in that sense.
Mm-hmm. Yeah, and I would also love any examples you have on, for example, quantifiable outcomes or metrics that you have used, if they work or if they don't work so well. Yeah.
Absolutely. I've already shared a few examples, but I think to date, because it's still growing and still replicating, but to date, we've reached over 419 million people with the Changemaker United program, and it continues to scale. It's grown into 35 countries, I think four or five continents. So at the moment, kind of our reach and the number of people that we're able to address is what we have to share. And then we have the individual examples of the programs, of the innovations, etc. So we have sort of the macro picture, like I just mentioned, but also the individual storylines, which continues to grow.
Thank you.
If I may add to the question that you just asked, Kate was very on point. Now we look at it from we can look at impact from two perspectives. Now I would say the traditional and inherent approach is to have a nice big number. Usually that number comes in two flavors. Well, we want to spend $1 million, we want to spend $10 million on this problem. Or the other way is we want to touch 2 million lives. That is very correct. And there's nothing wrong with that approach. However, what as an implementing person on the ground, I am looking for a way to, first of all, agree on what is the cost of touching a life. Now, let me sort of give you one context. I have a good friend. He's a fellow Rotarian, and he has built over 30 schools. Over 30 schools. Now, when he does his planning, you see other people trying to build schools. They say, well, we need $16,000 or $25,000 to build a school. The problem becomes a $25,000 problem. Whereas this guy, what he does, he says, to build a school, I need 1,000 cement blocks as the total cost. Those 1,000 cement blocks, if everybody gives me 10 blocks, and if each block is 50 shillings, then I'll ask 1,000 people to give me 5 blocks each, and I have a school. But instead of giving blocks, you just send money to his account. The principle there is that he has reduced the project into the unit cost of a block. Now in this collaboration, we are also trying to do the same thing. What is the unit cost of engaging a human being? And so we say that cost includes contacting them, it includes data, it includes this, and that total cost of going to a home and identifying a health need becomes our core cost. Now, in that process, we say, okay, we as a venture we believe that the critical factors of getting to somebody are 1, 2, 3. In our case, it is sending the rider. That is about 10 cents for fuel, and then getting the rider salary for the day is about $10 times 60 divided by 60 homes, so it's like $6. 60 cents per home, and then the data is about 10 cents. So we know that for about 80 cents to 1 cent, we can reach a home. And that's what we put in our business model. And we promise our partners that with $100,000 divided by 80 cents, we should be able to reach this number of lives. Now, we then now say, okay, what are the other things that the partner would like us to do? The partner may say, we'd like you to do testing, we'd like you to do education. And so that increases the cost from 80 cents to $1.50 maybe. And so if the partner is willing to agree on that, then we could now say, okay, this is not part of our commercial model. We're using philanthropic grant dollars to drive that process. And so in that instance, we're now able to have a shared objective around what is feasible based on a given market need. And so the impact objectives now become very, very clear to all parties that with $100,000 divided by $1.50, we could reach X number of lives. And so that is really what drives the process as opposed to the other way around.
Yeah, thank you very much, Mocha, for walking us through this illustration. I think what I took away from that is really, with your partner having a joint understanding of what you want to achieve and reaching that common definition of, how you build that impact. Unfortunately, we always run out of time. So I just wanted to invite our three speakers to just close very quickly. 10 seconds max each. What's one takeaway as you think about collaboration going forward, in the COVID-19 context in the near future and also beyond? What's next?
Me? I would say alignment on the impact you want to make and the cost that it takes to do so. It's not about money, it's about understanding how you can reach the impact within a feasible business model. Because you need at least break even to survive, and in order to keep everybody involved, of course you have to make a profit. And so you need to understand both how you do that, how the entrepreneur does it, and not take his place or interfere with the model as well.
Thank you. Kate?
Sure, I would just double down on that and what I've said before, which is spend the time up front, really talking through all of these pieces around impact. It takes a lot of time, it takes effort, but the collaboration is what will make the difference, and every bit counts.
Okay, and last, Mocha. 10 seconds of wisdom.
Agree on the customer, agree on the cost before you collaborate, and make sure you have a lot of fun.
Yeah.
Fun. Thank you for reminding us. Okay, thank you everyone. And Lotte, closing please.
Yes, also from me, thank you so much, Mako. Thank you, Kate. Thank you, Mocha. And of course, thank you, Pei-Yoon, as well for leading this conversation. Now, before we close, I would like to invite you all to keep the conversation going here on Swapcard, either in the chat or maybe directly. You can connect to someone to continue this conversation. Also, if you're interested to contribute or to collaborate, let us know. Just reach out to us also here on Swapcard. And lastly, I would like to draw your attention as well to the European Fellowship Program. It's a co-learning and co-creation program for our entire community. If you want any more information, just go to the link in the chat and it will take you to the website of the program. Now, thank you so much. Thank you everyone in the session today, speakers and people who watched. I just wish you a very good day and hope you enjoy the rest of the summit. If you want to leave any last comments in the chat, please feel free to. Maybe one or two words about how you feel at the moment, or anything that you can take away from this session this morning. So wish you all a very good day, and thank you so much for watching. Bye.
Thank you.
Thank you very much.
Thank you.
Margot,
Bye.
Mocha, Kate, Lotte.
you.
Yeah, thank
Thanks,
you.
Lotte.
Bye.
Cheers.
Thanks, Lotte.
Bye.
Yeah.
Thanks, Mocha.